Then you're wrong. Just saying.
Just a little bit.
You're right. Crazy.
Take the pillow. All right. Now, what we want to think about is just like we thought about the position of the patient for our pelvic and scapular mob to make it easier for us to do the activity. We're going to think about her position as well. So, what do we know about weight bearing? What does weight bearing do?
Decreases tone.
It normalizes tone, right? So if I get her weight bearing, I've got her sitting in the chair, so I've got a weight bearing through her glutes and her posterior thigh. If I can get her feet down on the floor, I've got her weight bearing through her feet. I've got her arm positioned on a pillow, so she's weight bearing on that side. So the side that I'm going to mobilize is her right side, okay? So she's got her hand in perfect position. What I'm going to do is I need to get that thumb to escape. I'm going to put pressure into flexion, and then I'm going to grab that thumb and bring it out, okay? We haven't had this yet, but when we talk about Brunstrom, we're going to go over something called a grasp reflex. If you put pressure in the palm of a patient's hand, some of them will have a tendency to grasp your fingers and they can't let go. Even though they may be able to open and close their hand if there's nothing in their palm. But if something comes in contact with the palm, they grasp. And sometimes with your patients, you'll go to shake their hand and you'll put pressure and then you go, okay, you can let go now, and they can't, okay, because of the grasp reflex. So we don't want to invoke the grasp reflex. So what we're going to be doing is, on the thenar, okay, we're going to be abducting and extending that thumb, just putting pressure here, and then we're going to be grabbing onto the hypothenar. No pressure on the palm. What we're going to do, and what tends to happen, is that in the foot, when we talk about that as well, but in the hand too, is the intrinsic muscles that are located between the metacarpals get tight. And if you think about your hand has a lot of molding capabilities. I mean, it really is not just flat and you just do flexion, extension of the fingers. It really can mold around a cup, hold on to various things. And so we want to capture that mobility in that hand again. And again, the intrinsics will get tight first. So rather than trying to stretch with the metacarpals and bring them this way to stretch the muscles in between, we're going to stretch this way. Okay? Still is creating a stretch, correct? But it's going to be easier to do it this way than it is to do it this way. So we're going to put our thumbs on the patient's metacarpals, and then we're going to stretch up and down. So we're stretching the intrinsic muscles in between those metacarpals. Okay? And in a normal hand, you feel a lot of motion. Some of your patients, you may feel, it feels like a board. You can't move it at all. Then we're going to work our way down. So you're going to work your way down so that you've got your thumbs on those metacarpals and you're stretching the intrinsics in between. So we're going to work our way all the way down.
By down, you mean from this finger all the way to this finger?
Right. Well, the first ray over to the... Okay, so all the way down. So thumbs are going to be on the patient's metacarpals. Keep the pressure off the palm of the hand. Okay.
How do you relax the hand if you trigger that?
Hmm?
How do you relax the hand if you trigger?
It's difficult because number one, you got to try to remove the stimulus, and when they're squeezing really tight, it's really tough to remove the stimulus. So.
If you get a hold of you, watch out for the nails.
Oh yeah.
And they don't mean it, but
And watch out too if you have a patient, particularly sometimes talking about that in the skilled nursing facilities, who may have had increased tone for quite a long period of time, and they don't check because they don't see their fingernails, and it starts digging in to their skin. I mean, that can really be very, very difficult. And then sometimes if the hand hasn't been